Hi guys, welcome to my channel. I'm Malvika and I have a 15-month-old son. So today I'm going to talk about baby-led weaning. So this video is basically an introduction to baby-led weaning, the basic aspects of it, the things you should and shouldn't be doing, and the basic gear that you will be needing to proceed with this. So before I begin, I want to put a small disclaimer. I'm not a pediatrician or a nutritionist or in no way an expert in this topic. However, I went through the same thing with my son and it was pretty successful. So I thought I can share some tips and tricks with you guys, those of you who are first time parents or first time trying baby led weaning. So let's go and check out the video. So before I start explaining what baby led weaning is, I want to tell two important things to you guys. Firstly, as a parent, you have to be ready for this because it needs a lot of patience, and if you're not sure of something or if you're anxious about it, please don't continue with this. It might not be successful. So take your time. There's no compulsion that you have to start this by 6 months. So you can start it whenever you want, whenever you feel you are ready for it, go for it. And secondly, please make sure that your child is also ready. By child is also ready, I mean consult with your doctor or a pediatrician before you start anything new for your baby, like a new food or a new practice, anything that can be. Please consult with your doctor. Once you get a go ahead from them, then you can proceed with this. Okay, so let's jump into what actually baby led weaning is. It simply means you just have to skip the purees and dive right into finger foods when your child is going to start solids. That is most probably around 6 months of age. Yeah, it's really scary. So if you're not up for it, you can wait for a couple of months, make sure you're ready for it and your child is okay, and then you can proceed. But if you're comfortable and confident about it, you can start it by 6 months. So let's assume everything goes well, your baby is fine, and you start with finger foods. And then one might wonder, why don't we reduce the milk and then give more of solids for the baby? But please don't do that. If your child is between 6 to 12 months of age, the WHO recommends that the mother should feed the baby at least for 6 months exclusively and on demand till 1 year. So even now, between 6 to 12 months of age, breast milk or bottle feeding is the primary source of nutrition for the baby, and this is more kind of a snack what you offer as finger foods. So make sure you offer it as a small meal just once a day for the beginning. As much as possible, try making the environment really fun for the baby, because it's not always fun when you're trying to feed an infant, because it's their first time. They don't know that you have to pick up the food and put it inside your mouth. So it takes time. It takes at least a minimum of 2 weeks, but some children get a hang of it earlier. So please don't try to force feed your baby. If the baby is not interested, you can just let go. You can just skip the meal. It's all right. And second point is, do not distract feed your baby, as in don't put on music or show the television, distract the child and then trick him into eating it. Please don't do that, because it has really bad effects in the future. So try to make sure that the child is very clear that we are going to have food and this is food time. Once you consistently start following this, you will see a visible difference when your child is around 9 to 10 months of age. That's when they develop the pincer grasp. Pincer grasp is nothing but the coordination of the index finger and the thumb to hold objects or food. So this basically happens when your child is 9 to 10 months of age. They will begin to pick things up, pick food or toys or anything with their index finger and thumb put together. So that is the cue that the baby should be able to eat independently on his or her own without any help. So while you are feeding your baby, there are a million things that can happen. The most important two things that you have to consider are choking and gagging. There is a lot of difference between choking and gagging. Gagging is just a very normal reflex in the baby's body. When he or she eats too much of food and it goes far inside, they just spit it out. That's a very natural reflex. On the other hand, choking isn't. It is an emergency if you find your baby is choking. So, what are the differences between choking and gagging? Gagging is simply when the child makes a lot of noise or facial expressions and he or she starts to spit it out, the face becomes all red. Yeah, it sounds scary, but it isn't. It is actually a very normal process. But when it comes to choking, you will not hear the baby's noise at all. He or she will try to, but you will not be able to see any voice, and you can see the terrible look on your child. It is very obvious that the child is choking. So if you feel that that is what is happening to your baby, it is an emergency. Please call the hospital and get in touch with the doctor as soon as possible. If you want, you can also take an infant CPR first aid class and enroll yourself in the class and get to know about what actually happens when the baby is choking and what first aid you have to do in order to save the baby. You can also read up on other vlogs or blogs or books about baby led weaning, so you will get additional knowledge. Make sure you are fully informed before you start this for your baby. So, if you give the finger foods at the right consistency in the right age, then most probably you will not encounter any choking issues because the baby will be able to handle him or herself. So once they become older, they are definitely going to improve and be better at picking the food and putting it inside their mouth. But whatever it is, whichever the age might be, please make sure there is one caregiver present when the child is having his or her meals, because it's really important. Choking can happen to anybody, even adults in that case. So please make sure there is always one vigilant caretaker sitting next to the baby when he or she is having his meals. Another question many parents will have is, will my baby be able to eat finger food without having teeth? Well, yes, absolutely, they can. Even I didn't know about it when I started this for my son, because children can easily power through without having any teeth. They have very strong gums and jaws, so that makes it easy for them to chew. So you don't have to worry if your child does not have any teeth, you can go ahead. So basically, what are the things that you will be needing before you start this? As a matter of fact, you don't need much. You just need a baby and some food. That is pretty much it. You can put him in a diaper and make him sit on your lap and give him food. That is also fine. But if you want to reduce the mess, you can buy a certain things that helped me with my son. So, firstly, I would like to talk about bibs. Bibs are really helpful because when kids try to eat for the first time, they try to spit a lot of food. It goes everywhere, most of it on the baby itself. So, in that case, if there is a bib, most of it will get held in the pocket of the bib, which is easy for us to clean. Also, there are various kinds of bibs. We have fabric bibs, silicone bibs, and we have the ones like a shirt that you put it on and tie at the back. I have both fabric and silicone bibs with me, and I feel silicone bibs are better because it's easy to clean, you don't have to do the laundry, and you can just wipe it and use it the next time. They are very, very handy. Secondly, you might need a good chair for the baby to sit in. It can be a high chair or a booster seat or just a Montessori training chair and table, which is more than enough too. The child just has to be sitting in an upright position with stable support. That is more than enough, but it is actually needed if you want to try finger foods. It's also good to invest in some cutlery, small forks and spoons for the babies, and you also have different kinds of suction bowls wherein they stick to the pan of the tray of your high chair. It doesn't move unless you pick it up in a particular way, so the kids won't figure it out on their own. You put some food in it, you keep the suction bowl on the high chair, and it does not fall down. It is a really helpful tool. It was helpful for me too. So if you can try using those. So that's pretty much it. You won't be needing anything more than that. Just a couple of bibs, a high chair, and some cutlery and suction bowls and spoons. So some of us might wonder, what can we give as first foods when your child reaches the 6-month mark? Well, it's actually a very vast topic, so I will be covering this in my next video in my baby led weaning series. So please make sure you watch it. Do subscribe to my channel if you find this video useful. So that's it about introduction, guys. I hope this video was really informative and useful. I'll be back with another video on this baby led series. Till then, take care and bye bye.